Good morning, everybody. I'd like to call to order the Public Health and Community Service meeting, October 2nd, 2025 at 8:30. Could I get a roll call, please?
Hendricks. Krager. Here. Van Hoff.
Present.
Sullivan.
Here.
Shorten.
Here.
Altough. Lumberden.
Here. Could I get a motion for minutes approval for August 28th as presented? Mr. Sullivan, seconded by Ms. Van Hoff. All those in favor?
Aye.
Against, motion carries. Public comment?
We have none.
We have none.
Last call.
Okay.
Alex? Sure.
Okay, moving on to members' comments. Is there anybody that has any comments? Okay, seeing none, we will move on to new business, and we have an interview for the Mental Health Board. And Mr. Swarthout, if you could please join us, and you wouldn't mind telling us a little bit about yourself and your interest in the Mental Health Board.
I was on the Mental Health Board many years ago. The reason why I'm here is to interview, certainly for the position. My background is, I've been a priest for 40 years, first and foremost, but I have an extensive clinical background, addiction and mental health. Served as the director of addiction and behavioral health for Alexian Brothers, Rosecrans for many years. So my clinical background, I have an advanced clinical background, master's in social work. I don't know for how many years. I'm since retired, and all I do is consulting with treatment centers and hospitals throughout the country, pretty much. Still sit on the board at Alexian Brothers, on their foundation board, and help with integration of addiction, behavioral health, mental health, co-occurring issues. I deal with a lot of trauma work with our frontliners, our first responders. I would rather shift that language from first responders to frontliners. The teachers, you are all frontliners. And I think those are things that we have to deal with more so than just be first responders, certainly dealing with firemen and trauma issues. And I'm really here just to help support the community that I've been involved with and lived in for probably over 45 years. So happy to be here. Know some wonderful people that I've experienced over my life and been in the community and served for many, many years. And it's a delight to be here.
Wonderful. Are there any members with questions? Mr. Short.
Please.
So what are your thoughts on the use of the 708 board funds for administration versus delivery of services?
I think that you have to integrate all of that. Administration is important to be able to recognize the mission, the metric, and I would say the margin that what we do. We did the same thing at the hospital as well as Rosecrans. You have to have somebody oversee quality and assurance to make sure that the appropriate dollars are spent in wisely, I would say, and not to silo. I think so often that we silo in the field of addiction and behavioral health, i.e., this group says we only deal with addiction or behavioral health or mental health issues. What we need to do is to align ourselves in so many ways so that we can enhance each other. I'm a big Malcolm Baldrige guy. I'm a guy who believes in aligning our work together so that really all of us have the same goal to help people to enhance their lives, and I think we have to align ourselves to work together for the good of all. Everybody wants to go in a different direction. This is the way to go, that's the way to go. Our role in terms of administration is certainly to oversee, but at the same time enhance the people who are on the ground so that they can have the services and the resources so to enhance those people that have the real needs. So our role is to really to help fill the gap for the addiction and behavioral health. As a person in the program for some 27 years now, I realize that we have to all work together. So administration and getting the boots on the ground really need to work hand in hand.
And I'm going to ask a more specific question, and if you don't know the answer, that's fine. 'Cause
I'd be happy not to have the answer.
I know high-level data, but do you have an opinion as to how the funding and the structure of the administration now is, and is it adequate? Should it be increased, decreased?
I believe what's going on is there's some shifting going on that maybe I'm becoming somewhat aware of, certainly a new administrator. And I think working together, do I have the nuts and bolts of exactly what's going on? No, I don't have that. But I do know that the people and the personalities all should work together for the good of the community. You know, I don't sit on the board, but I certainly have an ability to understand how the mission should lead, but understand the metric and I would say the metric and the margin has to be for the good of the community. Your tax dollars going for the good, but people have a right to have joy. And I think our role is to enhance good living the best way we can do that. Shifting goes on all the time. What you know to be true today will not be the same what we know in 20 years ago. When I first got in the field 40 years ago, and the way the field of addiction and behavioral health has shifted immensely, certainly since we've had the pandemic, understanding IT, that's all evolved, working with you know, insurance companies, Medicaid, Medicare, that's all shifted in a big way. And that's gonna continue to shift. And I think we need to be on the front line in many ways to look at the future, what it's gonna look like. And I think we all do that differently.
So you mentioned mental health and behavioral health and substance abuse, essentially.
Right.
The other component of the mental health board is intellectual and development disabilities.
Absolutely.
Which I think is really the area that doesn't get the attention that it should. We have, I mean, I went to one, I forget it was called a town hall, and the people that resonated with me were those that have children that there's nothing in the county for them. Matter of fact, they're looking towards the time when they pass, what's going to happen to their children. The facilities that exist are on the other side of the country. Any ideas on
The intellectual pieces, understanding autism, I haven't let it expire, but I have a type 73. I used to have a type 73 in education, in administration and education as well. So I worked for Crystal Lake School District as a social worker, helped direct their social work program. So I certainly understand the IEP. The 708 board was involved, I believe, at some time, if not still, with the school districts, and how to enhance an awareness and an education with all the school districts at the same time. Certainly working with our school superintendent, with our principals is essential. How to enhance the good of the kids that are in our school. You should also know, in terms of adolescent addiction and behavioral health, there's huge gaps here, but I think gaps, even in the state of Michigan, is worse. The closest program for inpatient adolescents is Rosecrans. We do, or also Ascension has that as well, because we have a huge program for educational issues. Kids who are cutting classes and have anxiety or stress issues, that we have programs such as that right here in the county. I don't know if you know, Ascension has the 10th largest behavioral health hospital in this country right here, that we deal with integration and all aspects of addiction, behavioral health, and intellectual abilities that people from all over the country come to look at. Our eating disorder program is an essential. I know Rosecrans, I'm delighted just to enhance their eating disorder program. At the same time, Ascend, if I'm not mistaken, but bringing all that information and awareness, not just to the families, but to the counties, and how to, there's no wrong door to finding an ability to have joy and to find health and happiness for the family and the whole community. How that's done is done in so many different ways. If you get a handle on that, tell me about it.
Thank you, appreciate it.
First of all, thank you for being here, and thank you for your interest in
certainly.
volunteering or the desire to volunteer and be on the mental health board. report.
Please.
It's great to have volunteers, like yourself, who have years of experience in the field. I wanted to ask you, what is your viewpoint? When we were discussing budget some time back,
Correct.
one of the suggestions that came up was using professionals as volunteers to meet the demands of the budget. So as you know, the costs that we have to pay for, various therapists it continues to rise. And that was one of the things that came up. What are your feelings about that, using volunteers to do the work that, we wouldn't contract?
Absolutely. I sort of get in trouble when from the other professionals in the community and treatment centers, because I think one of the best programs, addiction programs in this country, by far, is a place in Wayzata, Minnesota. And it's called The Retreat. And the reason why, because alumni come in and they present to people who are struggling with addiction and behavioral health. And so when people can press the flesh and say, I've been there, and then they have an alumni person, somebody has experience, and much of those people are doctors and educators, lawyers, psychiatrists who are also, certainly you can get people to part-time do, volunteering. But again, you have to make sure the quality is there. And quality and equality is there. Listen, I'm a retired guy now. If I can enhance the good of the community in my free time, I'm humbled, happy to do that. I think I've done that all my career. Somehow I've lived through it and then still have a sense of joy. So finding the right people to do that, you could certainly open up the door to have that. And I know that with alumni and people who have addiction or behavioral health issues. I helped develop the alumni program at Rosecrans. And when that program really opened up, that really made it work in a more enhanced way. Same thing at Ascension or Lexington Brothers. I helped develop that alumni program so that people who have touch, disease, or behavioral health issues are able to find other people of like mind or like heart, or have felt the pain and find joy walking through the dark tunnel in some ways, they can get better. I don't know if you can fill the gap on that in a full way, but I think the greatest way to fill the gap is awareness, conversation. No wrong door to finding help and wholeness. It's no wrong door.
I just have one thing.
Please.
Do you have family, children? Do you have children?
Well, that's another great question. No, I don't, but I have 74 nieces and nephews.
Okay. Plenty of children in your life.
No, I don't. God didn't give me children, but I have 74 nieces and nephews.
Okay, just curious. You're thoroughly qualified for this, so I approve.
Oh, well,
Do you like to be called James or Jim?
Jim.
Okay, thanks.
Listen, I've been a priest for 40 years. You can call me anything you want.
Understood.
As my mother has.
Okay,
Continue to have joy. I so believe. I grew up, my father was mayor of Lake Forest. I was just telling a young man over there that my father was mayor of Lake Forest for many years and very involved in politics and aligning the community. My brother became the president of the hospital. We're very active in the community. People have a right to have joy. And any way to offer that hope and joy to people, that's what I get to do. And I'm happy to align and support, say, I know this person or that person, let's work together. Yeah.
Well, I also want to thank you for
Thank you.
being here and your interest in the position on the Mental Health Board. I'm going to take over Ms. Altoff's line of questions, just because, we like to ask the same of all interviews. Have you recently attended a Mental Health Board meeting?
I've watched it online, yeah, and I've been to different activities that they have. I love the hot sheet that they have. Right? Yeah, I love the hot sheet that you have. That's really, it's an inviting, it invites people to become more aware and engaged. Yeah, I think it's wonderful.
And as you mentioned.
We didn't have that way back when.
Yeah.
That's-
It is a nice, so you mentioned that you're retired.
Yes, I am.
But one of the most important things, you know, in volunteering
Please.
or being on a board is the ability to make the commitment to attend all the meetings.
Sure.
Is that something that you're able to commit
The
to?
only one that I see right now I'm not making is I go to in February I go to Florida.
I wish I could go to Florida.
How's that for an honest answer? It will happen to you someday too.
Okay, does anybody else have any other questions? No. Okay, well, with that, thank you again.
Thank you for
very
your
much.
service.
You're
you.
welcome
Yeah,
to
thank you for
to
your
stay, or you're also welcome to go ahead and get on with your day.
We're gonna put in, we're redoing the kitchen today.
Nice.
On my way back.
Nice.
Thank you all.
Thank you.
so much.
Thank you.
Well, I remember James so well.
Hey,
will.
so we will
Thanks,
work
man.
right
Good to see you.
into
Good to see you.
deliberation and selection to move forward.
I would like to make a motion to forward a recommendation to the county board chairman to appoint James Swarthout to the mental health board for the term that begins October 31st, 2025 and expires on December 31st, 2026.
I get a second. Ms. Van Hoff seconds. All those in favor?
Aye.
Yes. Okay. Motion carries. Okay, on to the routine consent agenda. Are there any items anybody would like to pull for discussion?
6-2.
I'm going to pull 6-1.
Okay,
I was going to
so
pull both of them, but Gloria beat me
we
to it.
will pull both of them.
Because both are perfunctory, but also with the discussion that we're having about budget going forward, anything that involves money, I think we need to at least have, you know, a base presentation and ask questions if there are, so.
Okay. Well, then can I get a motion for 6-1? Mr. Shorten?
Oh, so moved.
Okay.
Second.
Ms. Van Hoff. So, discussion on the senior service grant funding allocation. Good morning.
Good morning.
Good morning.
Well, this discussion really should start with, this was a long meeting and this team and the commission did an awesome job. A lot of endurance and went from Friday 8:30 to 5 and then got scurried out of the building and then came back in for 9 o'clock and to 10 o'clock in the morning on Monday morning to continue the deliberation. So I'll start there. Did you want an overview or did you have any specific questions?
I just, for edification purposes, I understand we have a senior services board, which consists of how many people at this point? It's fairly large. And Dina is on that, and also Paul Thomas? Okay.
And Pam.
Pam.
Yeah, the chair.
Yeah.
And Carol.
So you go through a process where I'm doing it for you. Tell me if I'm wrong, stop me.
Okay.
But you go through a process where we have this $2 million, which is what we allocate. This is for next year's, or for the fiscal year 2026. So presuming that we approve that funding of $2 million, that you go through a process where you receive, I'm assuming, applications from interested agencies, and then, like you said, a day-long interview process where they do presentations, ask questions, correct?
Correct.
Okay. And then I'm assuming that there's more agencies that make requests than
Always.
what's approved.
And the money.
And
This year, everyone was able to move forward and give a presentation, but some did not receive them.
Okay. And do we know, from a dollar perspective, how much the applications exceeded the potential funding?
It was over 600,000.
Okay. So it's gone through a process. That's all I have. I just, like I said, anything with money, we need to make sure everyone has got a full understanding, and also from a transparency purpose to the general public, make sure that they understand what's going on. Because there's a lot that goes on here. It's more simple, and the board meets twice a month, and we vote, and that's it. So.
And I add one more component to that, is that the funding source is pure tax dollars. It was in 2003, it was a referendum that was passed as a portion of the property tax levy. So it's 0.025% that goes, and it caps it at $2 million. $2,005,000.
So,
Also, Michael,
yes.
prior to our interviewing with all of the services, everyone received their proposals from each entity, reviewed it, and had a rubric to score how we personally deemed. So that was also part of that process.
So, question on the administration side. Once these awards are made, how, just with a conversation about the mental health board and measuring success, is there a similar type of process that takes place with these dollars? Who manages it, and what's the scorecard look like?
Sure. So, yeah, I mean, this would be part of the team. Maria would be heading it up.
Yeah, so between myself and Eric, who is another specialist, we keep track of their spending. They quarterly they'll submit their spending, and then we reimburse them every quarter.
Okay. And do we have measures of how many people they serviced?
Yes.
That sort of thing? Okay.
Yes, they report on all of that.
Okay.
And duplicities of those services.
I'm sorry.
And duplicities.
Okay.
And I would just add too that we are going to be monitoring at least 5
5 agencies per
this
year,
Yeah.
like an audit.
So that's all done within your department?
Yep.
Okay.
Correct.
And do we have any tracking as far as cost of service to the senior services program, or is it just part of the overall budget?
Like staff time?
Yeah.
I mean, we do. There's actually a general fund component that aids in the administration of it. So that's a portion of the staff salaries.
Okay.
In terms of that monitoring and kind of that's what the managerial staff would do. So every 2 weeks, as we look at it, we make sure that we're not overspending time in that sense, because it's when we come forward with the budget, that's part of the allocation for our budget is we look at 80% or 60% of this person's time is dedicated to this grant, and that can't exceed. That translates to us as dollars, and then it goes to the same thing for federal grants or state grants or anything along those lines. So some of them are 5%, some of them are 60%, and so it kind of calibrates a little bit, and then we look back at that kind of maybe quarterly, and then definitely quite a bit through the budget to verify that we're on track, so that we don't bring the same thing next budget cycle and we're off again or something like that.
So just to make sure that I heard correctly, so if I called you this afternoon,
All right.
hypothetically,
Hypothetically.
and I said, okay, in fiscal year, just full year fiscal year 2024, how much did you spend on senior services grant commission administration? Is that a number that you could pull out and tell us?
Yeah, in a couple different ways, yeah, for sure. So we can go through salaries, or we can go through expenditures with D through
I may call you, it might not be this afternoon.
All right.
I'll be ready.
Yeah, all good.
All right, that's all I have.
Okay. Do we have any other questions?
And those staff that are monitoring the senior service, they have other duties as well. It's not only that.
We have other grants.
Yeah. Awesome.
Okay, Seeing no further questions, could I get a roll call, please?
Shorten,
Yes.
Sullivan,
Yes.
Van Hoff,
Yes?
Prager.
Yes.
Prager, I'm sorry. Von Bergen.
Yes. Okay, thank you.
Thank you. Thank you.
Resolution authorizing county to enter into a contract with National Business Furniture for the purchase of furnishings for Crystal Lake renovation project. Is there a motion to Mr. Shorten?
Second.
No discussion.
Yeah, I just wanted to know a little bit more. I mean, I know we know that this is going to happen. We talked about this before, that there would be additional furnishings and items like that that were needed. I just wanted to ask a question about how does this fit into the budget? With some of the things that, have you found that you have estimated properly what you will need, or did you get some surprises, or what does that look like?
Well, we are doing very well with the ARPA budget. We're fine there. We reconfigured some of the spaces in the areas because we had people in offices, 2 to an office, 2 to an office, 3 to an office. You know, staff tripping over each other, we had clients coming through. So the reconfiguration makes it a straight line of cubicles. It's much more efficient, it's safer for everyone because now staff has their side, there's a corridor for clientele only. Same on the other side with animal control, they have their own spaces where they're not on top of each other. So the additional configuration of furniture, we had a grant for, and we had planned this probably starting a year ago, talking about using this other grant. So we are not asking for money. The money is in the budget, it's all budgeted. We're just asking for approval of the contract.
That sounds wonderful. That's great.
We think so too.
And these are ARPA funds?
Part are ARPA, and then the reconfiguration is going on a grant that we received in 2024. It runs through 2027. The SIPA grant, Strengthening Illinois Public Health Administration grant. And so those funds have already been approved by the state of Illinois, and we're very excited to get this project rolling.
Is there any risk, just thinking at a higher level, the governor just issued an executive order to the state across the board to cut expenses 4%. Is there any risk that grant?
The grant was prepaid. We already have the money. It was prepaid for
Yeah, once they get
2024.
it,
It's in the bank,
it's
it's ready to go.
Unless the man with the badge shows up and says, give us some money back. we're probably okay.
Right.
All right, got it.
Well, it seems like it's making great progress. I travel by there every day and it's just coming along well.
It really is. We're excited. I know the Board of Health asked for like a walkthrough in November or so. So if anybody would like to join them, we'll let you know when that'll be so you can kind of see the progress and what it looks like.
And I just had one other question that wasn't done. I was just curious, what happens to the pets during this?
They're there.
They're there? Okay, so you
Yep,
kind of
we're
working
working
around
around
them?
that,
Okay. All right. Yeah, thank you.
I have a question. We talked last time about the wireless situation and the Wi-Fi. Is any of this allowed to use to offset that cost?
That cost is included in the furniture, fixtures, and equipment. So in order to get this grant, we can now put that into the equipment portion, so we won't be.
Yeah, so they'll come off the
That'll
supplemental
come off.
request.
Nice, okay, seeing no further questions, could I get a roll call, please?
Van Hoff,
Yes.
Prager,
Yes.
Sullivan,
Yes.
Shorten,
Yes.
Von Bergen.
Yes,
Thank you. Thank you.
thank
Thank
you
you.
so much.
Thank you.
Oh, no, that's okay. We kind of have an.
Okay, so we will move past old business, presentations, reports, on to future topics, and the location of our next meeting.
Well, actually, I was going to just give a brief report if I could.
Oh, okay.
Amidst the federal shutdown, we continue to monitor all of our federally funded programs. I can just confer with Melissa and Ann earlier in the meeting about how health departments are going to be impacted, and they're receiving guidance from the state that things are status quo. But we're continuing to monitor that. Workforce Network is fully federally funded, as you know, through the WIOA grant. I'm going to confer with Jake and Jeff, and they indicated that they're good through the end of the year as far as their funding and working with the state and the amount of money that they have on hand. But we'll continue to monitor that and keep you updated of any significant changes.
Thanks, Pat.
Thank you.
All right.
Thank you much. So, okay. Location of our next meeting?
Yeah.
Is it here?
I'm unaware of any location change, so.
So there's just a little, so Judge Hanson has asked to use these rooms for a domestic violence seminar. It's going to conflict with your meeting. We think that's a pretty important use of these rooms and a service that Judge Hanson wants to put on. So that's going to displace your Public Health and Community Services meeting. So we have a couple options. We actually have a meeting room downstairs. We call it the 104. Actually, there's two 104s. And so we can meet in this building and meet down there. Those who've been on the board for a while may recall that we used to use one of the 104 conference rooms for meetings on a regular basis. Whenever because we would get a lot of conflicts, and especially around election time, if you remember that. But that's an option, so we can meet in this building. But you know, I do want to suggest that we can look at other options. If you wanted to do something off-site, and Workforce Network has a conference room, I could see if that's available. You know, that's a service that this committee has oversight on, and that might be something good just as a change of venue. So really, I guess the option would be for you. Convenience would be here, just finding a different location, or I can see if Workforce Network would be available. I haven't explored that yet before this meeting, but I can always ask that question.
Is everybody?
I've done a tour of the Workforce Network. It's Workforce Network ETSB facility.
Mm-hmm.
Has everyone else done that walkthrough tour?
It's been a while, but.
Yeah, I mean, it's been 2 years. So there could be value in that, having it there if you wanted to integrate in a 30 to 45 minute overview of both of those organizations and walk through the facilities. I mean, in my opinion.
We could use Scummy.
So that's a no.
I mean, if it's nice weather, we can wheel it across the street and over there. Potentially, we could break it down and put it in Kriegerized vehicles.
So that might be a bit of a challenge.
We would need to go bring it there and test that we have the proper connections and everything first, too.
Let's make it easier.
Okay.
We'll just go with
It's possible.
104.
Yeah. We'll-
Yeah,
104.
All right, 104.
So
It's a
so
little-
104, and then we walk over to
No.
I'll go back
If
to
it's like,
You
what,
could do a tour over
Yeah.
there, but yeah, I think, you know, logistically, it would be better if we did 104.
It'll be a little tighter,
Yeah.
but,
yeah.
okay, we will go with 104.
Also, it's good to know that in 104B, we will be able to live stream, but there's not the capability for Teams down there. That's what I was told, so nobody could call in. So, you know.
Okay, thank you. Okay.
104 will be. Well, we could set that tour up though too. It would be good to see.
Just a heads up, I have Spirit Week that week for Halloween, so I might be coming in spirited clothing. Okay.
Even more so?
I cannot wait.
Even more so.
We would be disappointed if you
Okay.
did not.
I know. I'm all about a
Just make it
theme.
spirit meeting, everyone shows up in some sort of spirit.
One year,
Okay.
Melissa came in full costume, and everybody had a hard time and,
Focusing.
yeah, well, not focusing, but nobody knew that it was her.
Yeah.
It was so good. Yes.
I'm here for that.
So thank you, Melissa.
Okay.
Do that for us again, please. If you're watching. Okay, I see no executive session required, so motion to adjourn.
I'll make that motion.
All right, Mr. Shorten and Ms. Grandma, all those in favor?
Aye.
Aye.
Great.